Hi, my name is Sharbri Deshpande, and I'm so grateful to be here today. I am going to be presenting my research topic over a video because I'm currently at a Model UN conference. Dr. Raj suggested that in order for me to be able to present my topic, I could record a video. And so today I'm going to be discussing my topic on pediatric glioblastoma treatment using nanoparticles. So my name is Sharbir Deshpande, and I'm a sophomore at Woodbridge Academy Magnet School. I love to dance, read, and swim. And in the future, I'm thinking of going into pediatrics, specifically pediatric surgery. Hence, my research paper topic is centered on pediatrics. So in this presentation, I'm going to start off by kind of giving an overview to what glioblastoma is, and then dive into a few treatments that are currently available, along with nanoparticles and how they play a role in this treatment. Then I'm going to very briefly explain the formation of inorganic and organic nanoparticles, and then go into the diagnostics, therapeutics, and theranostics, or the usages of nanoparticles. Then I'm going to talk about two different delivery methods of nanoparticles, discuss a few of the future aspects of nanoparticles, and end with a quick conclusion. So to start off, what exactly is glioblastoma? Glioblastoma is cancer of the glial cells of the central nervous system. It is an extremely aggressive form of brain cancer, and due to its nature, it is difficult to treat sometimes. It is also one of the rarest forms of pediatric cancers that occur, and due to this, all the treatments for pediatric glioblastoma are primarily blueprinted off of the adult glioblastoma treatment. And so these current treatments include radiation therapy, surgery, and chemotherapy. These are typically the topmost done treatments, and they kind of all work together to treat glioblastoma. So you start off with radiation therapy typically, which shrinks the tumor down as much as possible before the surgery occurs. Then the surgery, also called tumor resectioning, is the process in which surgeons try to remove as much of the tumor as possible without damaging surrounding tissues. And due to improving technology, MRI-guided surgeries are now being used for tumor resectioning to make it more precise. Then afterwards, chemotherapy happens where medications are given to the patient that try to rid the body of any of the extra cells that were missed during surgery. In some cases, radiation therapy is also done after surgery to again try to remove or shrink any of the leftover cells that could not be removed through the surgery. And there are also more invasive treatments that are available, as you can see in the image I have on the screen. But the one that I'm specifically going to be talking about today are nanoparticle treatments. And what makes them so different from the rest of these treatments is that it has the ability to target brain tumors specifically by being able to go through the blood-brain barrier, which is where the majority of medications targeted for brain tumors kind of get filtered out through. And so this makes it a really powerful treatment that, if explored and researched more, can be used to potentially treat fully glioblastoma, which currently does not have the greatest prognosis in pediatric patients. So it's extremely important to understand how nanoparticles work so that this therapy can be used as soon as possible. So what exactly is a nanoparticle? I've been saying nanoparticles for a bit through this presentation, but what exactly is it? So they're 1 nanometers to 100 nanometers in size, according to the FDA. And the FDA also requires that at least one dimension of the nanoparticle needs to be between these size ranges. And they're so small that they're able to enter the bloodstream. And even though they might have larger counterparts that contain the same materials in them, they still exhibit different properties due to their extremely small size. And so to really put into perspective how small a nanoparticle is, there's a diagram that I have on this slide presentation. And basically what I did was I compared the range of nanoparticles to human hair, blood, bacteria, virus, and different molecules. So as you can see, human hair, blood cells, and bacteria are all larger than nanoparticles, and a water molecule is smaller than it. But the range or the approximate range of a nanoparticle can be compared to that of a virus and a glucose molecule, 100 nanometers to 1 nanometer. And so how exactly can nanoparticles be used when treating glioblastoma? So I already mentioned how they're less invasive and have the ability to cross the blood-brain barrier, but what exactly can it do with this ability? So they can either be used to diagnose, they can be used therapeutically, or they can be used theranostically. So in terms of diagnosis, nanoparticles can be used for brain imaging and brain scans in various ways. So for example, some nanoparticles have the ability to contain a dye, and when they are specifically targeted towards the tumor, the dye can be injected or given to the tumor specifically, and it kind of maps out the border of tumors, and then it's visible through brain imaging. And then there's also fluorescently tagged nanoparticles where you can monitor the progress of where the nanoparticle is throughout the body. So where it's located, where it is, to kind of get a picture of where the tumors are located in the brain. And then gadolinium-filled nanoparticles or gadolinium nanoparticles in general have contrast dye in them that give them the ability to be visible on MRI machines. So that's how they can be used for diagnosis of brain cancer or just monitoring of the brain tumor in general. Then you have the therapeutic usage of nanoparticles, and this can be either through active or passive targeting. And both of these allow for the delivery of high volume of drugs specifically to the tumor location. I will be going more in depth into this in the next slide. And then theranostic usage of nanoparticles is a combination of both diagnostic and therapeutic. So nanoparticles that are used for theranostic usages have the ability to both monitor or scan brain tumors in addition to treating them. So, for example, you can have nanoparticles that have drugs in them but are also fluorescently tagged. So you can A, deliver drugs, but also monitor them as they go through the body and target the tumor. So specifically about delivery methods. So there are two main delivery methods, like I mentioned, passive and active. And so passive delivery methods, the two that I'm going to be focusing on are EPR and TME. So to start off, the EPR effect, or the enhanced permeability and retention effect, occurs due to tumors taking over blood vessels. So when tumors form, they try to divert a large amount of nutrients to itself so it could continue to grow. And so they take over blood vessels to do this. But these blood vessels don't have as tight of a lining as typical blood vessels do. And so they're considered leaky blood vessels. And this basically just allows for small particles, such as nanoparticles, to enter into tumors through the leaky vascular structure. And then the second passive delivery method is TME, or the tumor microenvironment. And when tumors form, the location around them has a variation in their environment. So this can be temperature, pH. So specifically, I'm going to be talking about pH. So the environment around tumors are more acidic. And because of this, nanoparticles can be specifically formulated to release drugs when they reach an acidic environment, and hence they are passively delivering their drugs to the tumor. Now, with active nanoparticle delivery, you have antibody conjugated nanoparticles. And with this, there's basically antibodies that are conjugated onto the coat of the nanoparticle. And these antibodies are able to bind to specific tumor receptors. And so then the nanoparticles, once in the bloodstream, are able to target tumors only because the antibodies are going to attach to the receptors that are expressed on tumors. And then receptor-mediated nanoparticle delivery is similar to it. It's just that instead of using antibodies to bind to these receptors, the nanoparticles themselves are going to be formulated to bind to overexpressed receptors on tumor cells. One example of this can be seen through folate receptors. Folate either A or B, alpha or beta, are overexpressed in the majority of cancer cells. And so this is typically what nanoparticles are formulated to bind to. And these are just a couple of the different delivery methods that are currently being researched. These are just the most interesting to me, so I wanted to understand them in greater detail. And then lastly, what exactly is the future of nanoparticles? So they're being researched and explored today, clinical trials are being done, and they only will have a growing impact on the medical field. I have an image here that kind of explains where exactly nanoparticles can be used for treatment. And as you can see, brain cancer is one of the usages. In addition to that, lung cancer, blood cancer, liver cancer, colon cancer, the usages of nanoparticles in the treatment of not only cancer, but in general, medicine is only going to be growing and increasing. And so I think it's really important that, especially people who are going to be entering the medical field in the future, when nanoparticles are either going to be more established or more understood, it's really important for us to understand how nanoparticles are used now. And overall, researching this topic was really interesting for me because I learned so many new things that I didn't know before, and I feel like I really just expanded my knowledge in general of medicine, cancer, and the growing technologies of the future of medicine. So I want to end by saying thank you so much for giving me the opportunity to present this to you today. I'm really grateful for this. Of course, thank you so much, Dr. Raj, for guiding me through this entire process. I really appreciate it. And to all the friends that I made over this research program, thank you so much. All of your critiques, your positive comments was really uplifting throughout the entire process. Of course, thank you to my family for providing me with all the resources I need to be able to do this. And once again, thank you so much for allowing me to present this for you today, and I hope you have a nice day. Thank you so much.